Patients here.
Oh boy, got some blood going.
Yeah, there's blood.
Oh, he's wearing it too.
Welcome to the bed. When you get over to the bed, we'll go ahead and give you the story. This is all going to happen super fast. Welcome to the emergency room.
70-year-old female, single driver vehicle, appears that she went off-road into a ditch, rolled over, her car into a tree, caved in, the top of the vehicle was caved in, so she was hanging out partially from the window. She's been in application for
your left hand.
45 minutes of CPR. We can stop CPR with 600, 600, 600.
Welcome back to the Deep Dive. Today we are calibrating the time machine for a very specific frequency. We aren't going back to diapers and sleepless nights, and we aren't quite landing in the, the angsty door-slamming drama of high school just yet.
No, we are aiming for that sweet spot.
Yeah.
The era of scraped knees, trading cards, the smell of pencil shavings, and that overwhelming, burning desire to just fit in and follow the rules.
We're talking about the school-age child, roughly ages 6 to 12.
Mm-hmm.
And for the nursing students and pros listening to this, I know the immediate reflex is to just groan. You're thinking, great, another list of milestones, another chart of vital signs to memorize.
Which is exactly the trap we are going to bypass today. It's just not effective.
That is the mission. We are applying the 80-20 rule to this whole stack of pediatric textbooks, CDC schedules, developmental theories. We want to kill the rote memorization.
Yes.
We want to get to the cognitive engine that's running inside a 9-year-old's head.
Because if you understand the why, if you understand how their brain is wiring itself during this specific window, you don't have to memorize the safety risks. You don't have to memorize the communication strategies.
You can just predict them.
You can predict them. You can derive them.
You'll be able to derive the answer on the exam just by asking, okay, what would a concrete operational kid who is obsessed with competence do in this situation?
That's the goal right there. We want to move from what to why.
So set the scene for us. We've left the chaotic, the me-centered world of the toddler and preschooler. We aren't quite in the hormonal hurricane of the teenager years yet. How do we characterize this period?
I like to call it the calm before the storm, or if you want to be a little more clinical, the era of the mini adult.
A mini adult. I like that.
Yeah, because developmentally, this is a time of massive organization. The physical growth actually slows down, which surprises people. But the social and cognitive worlds they explode.
So they're not shooting up in height, but their world is getting bigger.
So much bigger. They move from the family unit being their entire universe to
the school.
The school and peers. They become the dominant influencers. It's a huge shift.
It's the shift from look at me, mom, to look at what I can do, coach.
That is the critical pivot. And it brings us to our first big pillar. Physical development.
Okay, let's talk about the hardware. Compared to an infant who, doubles their weight in months, or a teen shooting up 6 inches in a summer, this stage feels like watching paint dry.
It is slow and steady. We are looking at a weight gain of roughly 2 to 3 kilograms. That's about 47 pounds per year. And height is about 5 centimeters or 2 inches per year. It's just consistent.
So we lose that cute pot-bellied toddler look?
Oh, completely.
Yeah.
That aesthetic vanishes. They shed the baby fat, the legs elongate, their center of gravity shifts, and they become so much more graceful.
Right.
They look thinner, leaner, more athletic.
But there is a plot twist coming at the end of the stage, right? The textbooks call it prepubescence.
Yes. And this is a huge area for anticipatory guidance for parents and for nurses. Prepubescence usually starts in the 2 years preceding puberty. And here's where we see a significant gender split that can cause a lot of social friction.
How so?
Well, toward the end of the school-age period, let's say around 10 to 12 years old, girls often begin to surpass boys in both height and weight. The growth spurt for girls typically hits before the boys.
Oh, I remember that vividly from middle school. All the girls were suddenly looking down at the boys, and let's just say nobody was happy about it.
It's a genuine source of distress.
Yeah.
Body image issues don't just start in high school. They start right here.
Yeah.
If you have an 11-year-old girl who is suddenly a head taller than all the boys and carrying more weight because of prepubescence, that impacts her self-esteem in a big way.
So what's our role there?
As nurses, we have to normalize that. We have to tell them and their parents, this is exactly what your body is supposed to be doing. It's healthy. It's normal.
What about what's happening, under the hood internally?
The immune system is finally maturing. So they generally get fewer infections than toddlers, although because they are in school, they are exposed to a wider variety of bugs. But I really want to focus on the musculoskeletal system. This is a common exam trap.
The bones.
The bones. They're ossifying, so they are hardening. But, and this is the key, they are not fully mineralized yet. They aren't as dense as adult bones.
Which means they break differently.
Exactly. They are prone to what we call green stick fractures. Think of a young green branch on a tree. If you bend it, it doesn't snap clean in two. It sort of splinters and cracks on one side.
Yeah, okay.
That is a classic school-age fracture. Their muscles are still immature relative to their activity level, so they can literally pull the bone apart if they go too hard in sports.
So they're writing checks their bones can't quite cash yet.
That's a perfect way to put it. They have all the energy in the world, but not the density to back it up.
Okay, so let's pivot to the can-do versus the cannot-do. This is the bread and butter of clinical assessment. What are they capable of?
The motor skills are just night and day compared to a preschooler. Fine motor skills, especially, just explode. This is the age where the nervous system myelination really reaches the fingertips.
So they can do more detailed things with their hands.
Way more. They move from printing letters to cursive writing. They could sew. They can build those complex Lego models with the tiny, tiny pieces. They can play musical instruments like the piano or violin because that independent finger dexterity is finally there.
And self-care. Are we done helping them brush their teeth?
Mostly, yes. They can brush and floss effectively. And speaking of teeth, we can't skip what some people call the ugly duckling phase.
The gap-toothed smile.
It's the rite of passage. They start losing their primary teeth around age 6. By the end of this period, age 12, they'll have 28 of their 32 permanent teeth. But because the permanent teeth are so much bigger than the baby teeth they replace, the face can look a bit crowded or disproportionate for a while.
So they can ride bikes, play team sports, floss their teeth, and play the clarinet. They sound pretty capable. What can't they do? What is the fatal flaw in this system?
The fatal flaw is abstract reasoning.
Break that down to us.
They cannot reason about hypotheticals or nuances or future consequences without a concrete example right in front of them. They just lack adult-level judgment.
Okay, so give me an example.
They can ride a bike really fast, but they cannot accurately judge the velocity and distance of an oncoming car.
So they see the car, they see the street, but they can't run that little physics simulation in their head to say, that car will be here in 3 seconds, which is not enough time.
Precisely. They know the rule is look both ways. But if a ball rolls into the street, the abstract concept of future danger just evaporates against the concrete reality of I need to get my ball. The immediate tangible object wins every single time.
And that connects us directly to the cognitive architecture. We're entering the realm of Piaget.
We are. Piaget's concrete operational stage, roughly ages 7 to 11.
I always remember concrete because they are literally hard-headed about facts. Things are what they are.
That works. And the hallmark of this stage is the shift from the magical thinking of the preschooler, where they think their thoughts cause events, to logical thinking.
But there's a huge but here.
A massive but. It is logic that can only be applied strictly to tangible things, things they can see and touch and manipulate.
The classic example here is conservation. We have to talk about the water glasses.
This is the defining experiment, really. If you take a short, wide glass of water and pour it into a tall, skinny glass in front of a 4-year-old, they will tell you there is more water now because the level is higher.
Right. They're locked on that one dimension, height.
But the school-age child, they'll laugh at you. They understand the principle of conservation. They know that matter doesn't change amount just because it changes shape. They can say, you just poured it. It's the same water.
So why does that matter for a nurse? I mean, why should we care about water glasses?
It matters because it proves they can hold a concept in their head and reverse the process. Reversibility is a massive cognitive leap. It allows them to understand math. If 2 plus 3 is 5, then 5 minus 3 must be 2.
Oh, I see.
And it allows them to understand illness trajectories. I'm sick now, but if I take this medicine, I will go back to being healthy. It's not a permanent state.
This ability to classify and organize, it seems to spill over into their hobbies, too.
Oh, absolutely. Is there anything more school-age than a collection?
Rocks, stamps, baseball cards, Pokemon cards. My nephew has binders and binders full of them.
And notice how they organize them. It's not random at all. They group them by type, by color, by value, by power level. This is classification and serialization. It's a cognitive workout for them.
So it's not just hoarding.
No. They are exercising their new ability to create order out of chaos. They love order.
They love rules.
They love rules to a fault.
This brings us to the psychological engine that's driving all this behavior. Erikson.
Industry versus inferiority.
This is the absolute heartbeat of the school-age child. Define industry for us, because it sounds like they're, going to work in a factory.
It basically means competence. It's the drive to do things well, to produce results, to be useful. A toddler wants to play with blocks just to see them crash.
Right.
A
Yes.
school-age kid wants to build a castle that actually looks like a castle.
They don't just want to participate. They want the gold star. They want the A.
Exactly. They want to learn how things work. Success to them looks like tangible validation. Winning the game, earning the badge in Scouts, getting an A on the spelling test, or finally mastering a level in a video game.
And the flip side of that coin is inferiority.
Inferiority happens if they cannot meet the standards set by adults or their peers or even themselves. If a child constantly fails, or worse, if they are told their best effort isn't good enough, they develop this deep sense of inadequacy.
This feels like a huge nursing and parenting tip right here.
It is the most important one. We have to focus on the effort, not just the outcome. If a child has a chronic illness or a disability that prevents them from excelling at sports, we have to help them find their industry somewhere else.
So find their strength.
Find their strength. Maybe they can't run the fastest, but they can be the best at drawing, or they can master the rules of a game better than anyone else. They need to feel good at something.
I want to connect this industry and rule following to their moral development. You mentioned they love rules.
This is Kohlberg's conventional stage, specifically the law and order orientation. To a school-age child, rules are absolute. They are not guidelines. They are black and white. You are a good child if you follow the rules, and a bad child if you break them.
But there's a paradox here that always confuses students. The sources mention that cheating actually peaks between ages 6 and 8. If they love rules so much, why are they sliding extra cash from the Monopoly Bank?
Isn't that fascinating?
Yeah.
It is the direct clash between Erikson and Piaget. They have this desperate need for industry to win, to be the best. But they are still young enough that losing feels like a total failure of their self-worth. It's devastating. So they cheat to preserve their sense of industry.
It's not that they are sociopaths. It's that they can't handle the emotional weight of losing yet.
Exactly. Their desire to be the winner overrides their desire to follow the rule. And the best way to handle it isn't to shame them, because that just triggers inferiority, but to gently enforce the rules and teach them how to lose gracefully. You say, we play by the rules so the game is fair for everyone, not you are a liar.
Okay, let's move to safety. We've built this profile. A kid who is physically capable, thinks logically but not abstractly, loves rules, and wants to prove they're competent. How does that create specific dangers?
It creates what I call the independence gap. Their physical skills allow them to move far away from their parents on bikes, skateboards, at friends' houses, but their judgment just hasn't caught up.
Let's look at the number one risk: motor vehicles.
Still the leading cause of accidental death for this age. The rule is simple. Backseat until age 13. No exceptions. But the nuance here, and the thing you'll get tested on, is the booster seat.
Right. The sources were very specific on this. When can they get out of the booster?
The metric is 4 feet 9 inches tall, which is about 145 centimeters, or typically between 8 and 12 years old.
Why that specific height? I mean, why can't a 4'5" kid just use the regular belt? It seems close enough.
It's all about simple anatomy. Seat belts are designed for adult skeletons. They're designed to sit across the sturdy pelvic bones and the collarbone.
Okay.
On a smaller child without a booster, the lap belt rides up onto the soft abdomen.
Right over the liver, the spleen, the intestine.
Exactly. In a crash, that belt becomes a knife. It can cause what's called seatbelt syndrome, massive internal organ damage, or even spinal injuries. And the shoulder belt. If it hits their face or neck, they'll just tuck it behind their back, leaving their torso completely unprotected.
So the booster just lifts them up so the belt hits the bones where it's supposed to.
Yeah. That's all it does. And that is the kind of concrete explanation a school-age child needs, by the way. Don't just say it's safe. You have to explain why. Say, the belt will hurt your tummy if you are too small, so this seat helps it fit right.
Spot on. You have to appeal to their logic.
Always.
What about bikes and sports? We know they need helmets.
Helmets are absolutely non-negotiable. But here is the nursing challenge. Peer pressure. By age 10 or 11, wearing a helmet might not look cool.
And we're back to industry versus inferiority. If I wear a helmet, I look like a baby, and that makes me feel inferior.
You nailed it. So the nurse has to advocate for the coolness of safety gear, or at least the absolute necessity of it. You appeal to their industry. You say something like, your brain is the computer that helps you play video games and score goals in soccer. If you damage the computer, you can't play. You have to protect the hardware.
I like that. Let's talk about firearms. The sources had a very specific script for this age group.
Yes. And it's so important because even if you don't own guns, your child's friend might. The script is, stop, don't touch, leave the area, tell an adult.
Why is that so critical for them?
Because of their curiosity. That industry drive to see how things work. A gun is an incredibly tempting object to investigate. They know it's dangerous, theoretically, but that concrete desire to hold it and see it is so much stronger.
And fire and water?
It's the same driver. Curiosity plus a massive overestimation of their ability. A 9-year-old might think, I can swim across that lake because they did 2 laps in the pool yesterday.
Right.
They don't understand stamina limits.
Yeah.
So the rule is never swim alone. And for fire, they are fascinated by it. They need concrete fire escape plans practiced at home, not just a lecture about don't touch matches.
Okay, let's switch gears to play. We talked about collections, but how do they play with others?
So toddlers play next to each other. We call that parallel play. School-age kids play with each other. It's cooperative play.
And it has rules.
And because of that law and order moral stage, it is almost always organized play with very strict rules.
So we're talking board games, card games, team sports.
Yes. They love knowing the rules and holding others accountable to them. You'll hear a lot of, you didn't pass go. You can't collect $200.
Team sports seem to be the perfect storm for this age.
They really are. They satisfy the need for exercise, social interaction, and that drive for industry. They learn division of labor. I play defense, you play offense. But then, as a coach or a parent, you have to watch for that winning at all cost mentality, which can really hurt the self-esteem of the kids who aren't the star athletes.
There was also a note about solitary play. It's not all social all the time, right?
No, and that's very healthy. This is when you see the start of journaling, diaries with little locks on them, and quiet reading. They're developing an inner life. They are starting to value privacy.
Which is a perfect segue to clinical application. How do we treat this patient when they walk into the clinic or the hospital?
The first rule is treat them as the patient, not just an accessory to the parent. Speak to them directly. Ask them questions about what's going on.
How do you leverage their developmental stage to make the exam easier?
You use their industry. You ask them to help you. Can you hold this Band-Aid for me? Can you hold the stethoscope still on your chest while I listen? They love feeling competent and useful. If you make them part of the team, they are so much less likely to fight you.
And for procedures, how do you explain things?
Remember, they are concrete thinkers. Abstract medical jargon is terrifying because they imagine the absolute worst. Don't say, we're going to take some blood.
Why not?
Because that sounds like you're taking it away forever. To a concrete thinker, that implies a permanent loss of body fluid. They might literally think they're going to deflate or run out.
That's a great point. So what do you say instead?
You say, I need to put this small needle in your arm to get a tiny sample of your blood to check your health. It will feel like a quick pinch, and then it's all over. Show them the equipment. Let them touch the alcohol wipe. Let them see the Band-Aid you're going to use.
Make it concrete.
Make it concrete. Remove the mystery. It reduces their anxiety tenfold.
And privacy.
Huge. Modesty really kicks in around age 6 or 7. Always knock on the door, give them a gown, and make sure it's closed. Do not just expose them like you might a toddler. They are very, very aware of their bodies and any differences from their peers. If you respect their privacy, you earn their trust.
Let's talk pain assessment. This is a classic exam topic. Which scale do we use?
It depends on the exact age, but generally. For the younger school-age kid, maybe up to about age 7, we're still using the FACES scale. Point to the face that shows how much you hurt.
But once they hit that concrete operational stage,
once they understand serialization and number concepts, usually around age 7 or 8, they can use the numeric scale from 0 to 10. They understand that 8 is more than 4. A preschooler doesn't really grasp that magnitude.
And the sources mention the Oucher scale.
Yes, the Oucher scale is great. It uses photographs of real children's faces in pain rather than cartoons, which can be more relatable. It's good for ages 3 to 13. But the key takeaway for you is that unlike a preschooler, a school-age child can tell you where it hurts and what it feels like.
They have the words for it.
They can distinguish sharp from dull or running. They can be a really good historian if you ask the right questions.
Now, everyone's favorite topic, vital signs. We need to spot the trends for exams.
The trend is your friend here. It's simple. As the child grows, the heart rate and respiratory rate go down and the blood pressure goes up.
And why is that happening physiologically?
The heart is getting larger and the muscle is getting stronger. It pumps more blood with each beat that's increased stroke volume. So it doesn't need to beat as fast to circulate oxygen. That's why the rate drops.
Okay, give us the numbers to have in our heads for the exam.
The heart rate slows to roughly 60 to 110 beats per minute. Respiration slow down to 20 to 25. And you'll notice their breathing becomes more diaphragmatic. They use their belly muscles less and their chest muscles more, like an adult.
And blood pressure is creeping up.
Blood pressure rises, yeah. Systolic will be roughly 96 to 106, but it really depends on their height and gender.
Okay, stick a pin in that. Let's talk vaccines. There is a massive milestone visit in this era, the 11 to 12-year-old visit.
This is a money question on exams. You have to know this. At 11 or 12 years old, you are looking at 3 major vaccines.
Okay, what are they?
1. Tdap. This is the booster for tetanus, diphtheria, and pertussis. Note the P is for pertussis whooping cough, which is crucial because the immunity from childhood shots wanes.
Meningococcal, MenA-CWI. This is the first dose. This prevents meningitis, which is so important as they head toward camps, dorms, and college, where they live in close quarters.
HPV, human papillomavirus.
The HPV vaccine often brings up questions from parents because it's linked to sexual activity. How should a nurse explain it to a hesitant parent?
You frame it as cancer prevention, because that's what it is. You say, this vaccine prevents cancers caused by the HPV virus later in life. And you explain that it's recommended to start at 11 or 12 because the immune response is strongest at this age. It's actually better than if you wait until they're 16 or 18.
And the dosing schedule is different too, right?
Yes, great point. If they start before age 15, it's only a 2-dose series. If they wait until after 15, it becomes a 3-dose series. So there's a real clinical benefit to doing it on time.
And don't forget the annual flu shot.
Never forget the annual flu shot.
Health screenings. What are we looking for in school-age kids specifically?
2 big ones. First is scoliosis. We screen for curvature of the spine because this is the age of growth of births, especially for girls, and that's when scoliosis can worsen really rapidly.
Okay, and the second?
And second is vision. We're looking for amblyopia or lazy eye and other refractive errors.
What are the signs a teacher or a parent might notice?
Things like squinting, complaining of headaches, holding books too close to their face. And think about how this connects back. If they can't see the board, they can't learn. If they can't learn, they feel incompetent. They fail at industry. It all connects.
I love how you tied that back. It's a holistic system. Okay, we have covered a mountain of info. Let's try to optimize this for memory.
Let's look at the patterns. If you know they are concrete thinkers, you know they need concrete explanations and concrete safety gear like helmets and seatbelts.
Right.
If you know they're driven by industry, you know they want to help you in the clinic, and that their biggest fear is failure or inferiority.
And if they love rules.
If you know they love rules, you know they love organized games and they despise cheating. Unless, of course, they're the ones doing it to win.
Do you have a mnemonic for us?
Yeah. Try the 3 C's of school age. 1, concrete thinking. That's Piaget. 2, cooperative play, teams and rules. 3, conservation. They know the water is the same amount.
I like that. Short, sweet, and to the point.
And here is the 80-20 summary box to take home with you. If you understand that the school-age child is a mini adult driven by a need for competence, that's industry, within a strict world of rules, but limited by concrete reasoning, you can predict almost everything.
Everything falls into place from there.
You can predict their play, team sports, their fears, loss of control, failure, and their safety risks, judging traffic, curiosity about firearms. So treat them like rational partners who just need visual proof, not abstract theories.
That is the golden nugget right there.
And just a final thought to chew on. We spent 6 years teaching these kids to follow rules, to sit still, to be good, to organize their collections so perfectly.
And then
puberty hits. The hormones flush the system, the brain literally rewires for abstract thought, and all that rigid rule following gets blown to pieces in adolescence. So appreciate the school-age child while they are here. It's the orderly, industrious calm before the swarm.
On that ominous note, next time you see a 10-year-old perfectly organizing their Lego bricks by color, just give them a high five for industry. Thanks for diving in with us.
See you next time.